Principles of sports nutrition.
In Canada, dietary supplements are regulated and classified as natural health products. The acronym is NHP. So in Canada, we refer to dietary supplements as NHPs. And because they're regulated and policed by Health Canada stringently with applied action and force, NHPs in Canada are of the highest quality and rank second to none. There is no other country in the world that can produce and manufacture a dietary supplement, or in this case an NHP, with more stringent regulation than what we have in Canada. So when you go into a health food store and buy an NHP, a natural health product in Canada, you know that you are going to get exactly what the label says is inside the container. There will be 90 capsules, and each capsule will contain at least 400 IU or milligrams of D-alpha tocopherol. Now, this is not true for many, many other parts of the world where other countries may have the same definitions that relate to regulation and distribution and manufacture. However, what it comes down to, and this is just like the Olympics, if the athletes are not put through a stringent drug detection program, we can assume that many athletes will take drugs. If they don't have to worry about being caught, then they will take the drugs. So if manufacturers of NHPs or dietary supplements in other countries, US, Europe, Australia, if they don't have to worry about an inspection, about someone from the government showing up and expecting the standards of how they produce the vitamins, they will cut corners. They all won't cut corners, but many of them will, to save a buck. It's more profitable to lie, cheat, and steal in this world today. It doesn't have to be that way, but it is that way. So when you buy dietary supplements, you have to make sure that those who manufacture them, when they receive the raw material, that raw material is quarantined and tested and safe. And then when it goes into the capsule or the tablet or the powder or the bucket or whatever, the tincture, the liquid, the salve, the ointment, you have to know that the product that you're going to buy, that you're looking at on the shelf, has gone through really, really stringent regulations. Because quality control is what it's all about. Actually, that's not true. Quality control is very important. You could have quality crap. So knowing what is in the bottle and how it works and whether it's efficacious or not is also very important. You could put rat turd in a bottle and say that it is 100% rat turd. And the quality of the rat turd is very, very high. But you still have rat turd. And the question is, are you going to take it? So quality is one issue. Also, whether or not the substance that's in the container has any value. Is there any science to support it? Is it efficacious? And of course, is it safe? Is it something that you would feel good about feeding to your children? This is a big concern among parents in the field of sports nutrition. They don't understand creatine monohydrate or ribose or glutamine and how effective these things are and can be for kids, infants, young people in sport and activity and fitness. Now, when it comes to treating sports injuries with NHPs, the goal or the objective is more immediate, not so much long-term, although there is long-term value built into all natural health products, because it relates to immune function, brain chemistry, nervous system, all the systems of the body that cooperate together to facilitate healing. Remember that healing is inside the body. We assist the healing. No doctor, no practitioner, no guru heals anybody. It is life and the forces of life and nature and nutrition and fresh air and sunshine and all of that that adds up to complete restoration. But there are things like proteolytic enzymes, such as bromelain, papain, and protease, serrapeptase. These things help reduce inflammation and therefore pain and prevent the formation of scar tissue. There's a number of excellent remedies. There are the oils, EPA, eicosapentaenoic acid, DHA, docosahexaenoic acid. How about GLA from hemp seed oil, gamma linolenic acid? These fatty acids are well known and described, scientifically verified, to help support the healing process. Minerals like manganese, elements like glucosamine sulfate, curcumin, garlic extract. All this is about reducing inflammation. Comfrey, green-lipped mussel, amino acids abound. Homeopathy is another effective treatment in sports injuries. One of the most popular remedies is arnica. You see arnica in a great product like Traumeel. You see arnica in solution, in tabs. Go to any natural pharmacy, go to any health food store, you're going to see arnica there on display, advocated for injury and trauma. For severe muscle stiffness, try taking extra vitamin B3 known as niacin, and this greatly increases blood supply to the muscles by expanding the veins and arteries, vasodilation. And when that is facilitated, that brings blood and oxygen and nourishment to that area. How about taking some OPCs, an acronym for oligomeric procyanidins? Things like grapeseed extract or pine bark can inhibit the enzymatic cleavage of collagen by enzymes secreted by leukocytes during inflammation and prevent the release and synthesis of compounds associated with causing inflammation. So, at the end of the day, why don't you try fixing yourself? Use natural health products, NHPs. Get educated, go to the health food store, put it all together, and in doing so, you'll become more aware of yourself, your cells, your tissues, your organs. You'll become an anatomist, you'll become your own doctor, and you become less reliant on an industry that preys on your own ignorance.